Hi guys, this is Caroline Peregrino, psychiatric nurse practitioner out of California. Thank you for landing on my channel. Totally appreciate it. So just a little bit about me. I am a psychiatric nurse practitioner, board certified, and I graduated in 2015. Prior to that, I've been a psych nurse since 2008, and prior to that, 5 years before that, I was a psych tech. So I got myself up to where I am right now. I've learned a lot throughout this journey and also still learning every single day. So this channel, if this is something that this is your first time coming into this channel is specifically to you guys, to empower you, give you ideas on how to help yourself assert yourself in the workforce as a psychiatric nurse practitioner, be able to provide you the skills necessary so that you can be the best psychiatric nurse practitioner out there and be prepared to confidently, take care of patients. So if this is something that you would like to get inspiration from and you would like to get more skills and understanding about treatment, mental illness, and life as a nurse practitioner, then this is the right channel for you. So make sure you subscribe, you like, you comment, make sure you press the bell button so that you get notified for every single video that I post. Thank you so much. I will see you in a little bit. So hi guys, this is my sixth video since I started this channel, which was February 1st of 2020. And today what I want to talk about is perinatal mental health. And that is a big topic for me because I am a perinatal mental health certified psychiatric nurse practitioner, and it's something that I specialize in, and I love treating this population. So there's a lot to talk about this. I don't think this video is enough for you to get all that information. So this specific video is more just a general information about what it is, what are the risk factors, screening tools that you can use, what are the treatment principles, and a little bit of information about medication management, and also resources for you so that you can get more knowledge about treating this population. So let's begin. So this is statistics of moms experiencing perinatal mental illness is 1 in 7, and that is very high. If you think about it, how many moms when you're pregnant go to get their glucose testing, right? When they're pregnant, that's a given. You get your glucose testing. Everybody gets checked for diabetes, gestational diabetes. However, our moms who are, vulnerable, especially during pregnancy, emotionally, because of a lot of different physical factors that change, hormonal factors that influences their emotions, are not really screened. California is actually the only one since last year, I think it was last year, or this year. I'm sorry, not this year, not 2020, last year, 2019, who have just incorporated into the OB visit for moms to be screened once during the entire pregnancy for postpartum or pregnancy mood disorder. So it's not enough, but we are going towards the right direction. So I say about gestational diabetes because the risk for gestational diabetes in pregnant women is 6%. Compared to perinatal, mental mood disorder, it's 20%. So 6% versus 20%. 6% has more kind of regular routine screening compared to the 20% risk when we don't have anything. So I want you to understand the big problem, why this is like this in our healthcare organization. So 20% of moms who are pregnant or just had a baby will experience some sort of maternal mental illness, and 80% will have postpartum blues. Postpartum blues are like mood kind of symptoms, kind of crying, feeling like emotional, even though they're not feeling because of the hormones, and usually very limited. It's just usually the first 2 weeks transition from being pregnant to now being a mom and having this infant that's uncontrollable pretty much, right? So it usually gets better on its own, but depression is when the mom is feeling hopeless. There's a lot of anxiety, there's a lot of guilt, there's a lot of shame, there's a lot of feeling like I am not a good mom and the baby's better off without me. There's also sometimes suicide thoughts. So the intensity of the mood is a lot worse, and that means that mom needs treatment. Those symptoms needs treatment. So moms die from this. Okay, we don't have the statistics yet of how many moms die from maternal mental illness, but what we know is mood disorder in pregnancy and postpartum is the #1 complication of childbirth. #1, that is huge, right? And why are we still not having regular screening? I don't know. So if you guys are watching this, you don't have to wait for the law to change to screen your moms. Just screen them right now. If you remember Andrea Yates, I will post a YouTube clip on the bottom about during her interview. Andrea Yates is a mom who killed her children by drowning. I believe 4 children or 5 children under the age of 5 back in early 2000s. And during that time, no one understands what's postpartum depression, postpartum mood disorder, postpartum mental illness, and what it was. So she was condemned pretty much during that time as how can she do something like that, which is very horrible for a mom to do that. But I want you to watch her interview after she did the act, and she was interviewed by a psychiatrist, and she gave the rationale as to why she did it, and I think it's very compelling interview. It's really important that we looked at risk factors for women who may have more possibilities of having this, mood disorder during pregnancy and postpartum. And those risk factors include unplanned pregnancy, teenage pregnancy, domestic abuse in the family, history of mood disorder with prior pregnancies, multiple children, limited psychosocial support, limited financial ability. There's no spouse in the picture. That's actually #1. One of the most biggest risk factor is not having a partner in the picture to help out emotionally during the pregnancy. And that is, a huge risk factor. Also for us psychiatric nurse practitioner, if we're treating a mom and for a mood disorder and they became pregnant, then the pregnancy becomes a risk factor instead of a protective factor. So hormone changes creates this risk factor for depression and anxiety. That transition from being, not having a kid to having 1 kid or 2 kids, that is also huge. So that is also a risk factor. So if they already have a pre-existing mood condition, then they become pregnant, they're a lot higher risk to relapse during pregnancy and also postpartum. Especially for bipolar disorder and patients with schizophrenia or more of a chronic mental health condition. If they have that, then they are so much at risk for relapsing into their illness, into their symptoms during pregnancy and postpartum. A lot of providers, or even I can't say which one, but a lot of providers make a mistake that once a patient with a history of mental illness become pregnant, they stop the medication, and that is the worst thing that you can do for that mom and that baby. A lot of the times we always look into medication risk, and therefore the medication has risk to the fetus, therefore we should stop it. But you forget that the maternal mental illness itself has a big risk towards the mom and also the fetus and also the baby once it's born, because untreated maternal mental illness releases cortisols and a lot of the stress hormone, which affects the baby's heartbeat, which predisposes the mom to a low birth weight baby, prematurity, miscarriage, all of those things. So you always want to look at the risks and benefits. Untreated mental illness has actually a lot more risk and untoward effect to the baby compared to medication. But of course, you want to look at which medication, when it started, first trimester, second trimester, third trimester, because that would matter. As when is the heart developed, when is the brain developed, at what stage, right? We need to know that, so we know what could possibly be affected during this growth and development of the baby. So untreated mental illness also may cause addiction on the mom, alcoholism, marijuana use, risk for neglect and abuse of the child. They have less ability, probably less motivation to get the child into their healthcare routinely because of the mood disorder, right? Or if they've got more of a chronic mental illness. So that is a big risk, and there's studies out there that says, even I think it's from the American Academy of Pediatrics, where it says that the baby or the child born to a mother whose mental illness was untreated during pregnancy and postpartum has a much longer cognitive and psychological and behavioral negative effects throughout the life of the child. So I think they studied up to 7 years old, if I'm not mistaken. So I want you guys to remember that. So question I get is, what is the safest, right? What is the safest medication during pregnancy, especially psychiatric medication? There's really no safest. We can't say, oh, this is the safest medication, because that is not true. What we have is more evidence to support this, this side effect or this consequences towards the baby, and more evidence supporting, studies on pregnant women, or less evidence supporting studies on pregnant women on this medication. And I want to give you 2 examples of that medication. So Zoloft, actually 3 medication examples. Zoloft is an antidepressant that's very well known to us. Zoloft, there's a lot more evidence to support that was studied in pregnant women while taking Zoloft. Latuda, even though it's being advertised as a category B, and we're not using any more categories anymore in pregnancy in terms of safety profile, that's gone. So even though they say, oh, it's a category B, that means it's safe, but B means that it's only safe to animals, right? So that means there isn't a study that would support safety in real human pregnant person. So you have to be careful with those things. Buspar is also one of them. Even though it's been around, a lot of people think it's the safest, or is more safe, but we again have limited studies in pregnant women, so therefore we don't know much. And that's something that you want to educate your patient on, is that these are the studies on this medication, these are the risks involved, a lot of education towards the mom and the family, so that you both can make a much better decision together. This is not your own decision and say, oh, okay, this is the safest medication, therefore you should take it. It's not. It's going to be a risk and benefit discussion between you and your patient. So pregnant women who stop their medications, especially bipolar medications, I meant especially patients with bipolar disorder, they are at risk up to 80% of relapse. So if you've got a patient who has bipolar disorder on medications, you probably need to consider twice, 3 times before stopping that medication, not unless of course it's very teratogenic, such as Depakote, Tegretol. But again, it's risk versus benefits. It depends on what patients have taken before, and if this is the only medication that's worked for the patient, and you made that discussion as to what's the possible complication in pregnancy of using this medication. So again, treat to remission. What I meant by that is sometimes some providers will say, oh, okay, I'll give you, lexapro, which is an antidepressant for your anxiety and depression during pregnancy, and I'll give you the lowest dose, so that I'm concerned about how it would affect your baby, so I'll give you the lowest dose. In the meantime, you're giving the mom the lowest dose, but the symptoms have not remitted yet, so you're exposing the mom to the medication and her baby, and exposing her to the maternal mental illness. So do not, it's not recommended to do that. You want to treat to remission. If you and the mom decided to go on a certain medication, then you want to make sure that they are on the right dose for them to feel better. Because one last thing that you want is a mom having a really hard time after having the baby, right? Because postpartum is very high risk for a mom who's already having a mood disorder, depression during pregnancy. They're added stress because it's not just they're pregnant, having the baby inside, it's more controlled now. The baby's not sleeping, they're breastfeeding, they're healing with their wounds, C-section or vaginal, they're also healing, right? So there's a lot more challenges during that time. So these are kind of like a simple kind of summary of the principle of maternal mental health treatment, and I actually want to talk more about postpartum OCD and postpartum psychosis, what to do, how to recognize that, what are the treatment options for that, and that would be probably in my next videos. Hopefully sometime soon I'll be able to post that for you guys. If that's something that you'd like to learn more about, make sure you subscribe to this channel and hit the bell button so you get notified. As a healthcare provider, if you are interested in becoming specialized in this, you can get what we call Perinatal Mental Health Certified, and it is through Postpartum Support International. I will include the link to Postpartum Support International on the description box so that you can click it and get to their website and get more information about this. Also, Massachusetts General Women's Mental Health website is very helpful and full of information about women's mental health and how to treat pregnant women suffering from mental illness. They've got a lot of summary of researches, and usually I print it out for patient and we discuss it together, so we can both choose the right treatment for for her and her baby and her entire family. Because remember, you're not just treating the mom, you're also taking care of that baby, and whatever happens to them, it affects the entire family. So that is, very, very much impactful. So if you guys have any questions about this, write your comment. I will try to answer it to the best of my ability. And I hope you like this video. And please, I will completely love it if you share it with anyone who may be able to learn from this summary and get some knowledge so that she or he can be confident, or anybody, or they can be confident with treating moms with mental illness. Okay, thank you so much guys for listening to me for about 15 minutes, 16 minutes straight. Totally appreciate it. Okay, bye.